the African Union has announced that the Ebola epidemic in the Democratic Republic of Congo has been largely contained. John Nkengasong, director of the African Centers for Disease Control and Prevention, presented the recent situation of the epidemic at a press conference in Addis Ababa, Ethiopia. The African Centers for Disease Control and Prevention deployed in May a team of 25 physicians, including epidemiologists, infection prevention and control experts, to support the government's efforts. The head of the African CDC believes the joint efforts of the international community, which includes the World Health Organization and Doctors Without Borders, along with the Ministry of Health of the DRC, will allow the country to contain the epidemic. Now, VOA's John Lyndon spoke to DRC's Minister of Health, Dr. Oly Ilunga, who elaborates on the Ebola outbreak.
The Ministry of Health is the only institution which is in charge of protecting the health of the population. So, but our role was really to coordinate all the response. As you know, it was a government-led response, and the Ministry of Health was really leading the response and aligned all the partners. That many people, when they feel sick, the first people they go to seek treatment is the traditional healers. So we had to, from the beginning, to bring them in the game and to work with them. It took us a lot of discussion, information, to convince people that Ebola was not like an evil spell, but it was a real disease. But eventually, with communication, sensibilization, I think that now everybody accepts that Ebola is a disease. The biggest challenge, I think, has been a logistic challenge, because the outbreak started in a very remote area. So the logistic to bring human resources and equipment on the field was the biggest challenge. I think the vaccine had been a real game changer because it really helped us to break the transmission chain very quickly. I think that compared to the last year outbreak and compared also to the outbreak in West Africa, I think that the international community reacted very quickly. They were very quick on the response to raise money and also to send us some experts who really work with the government. My dream is to build a CDC in DRC, a Center of Disease Control in DRC. That's the first thing. I think the second will be certainly the logistics. I think if we could have our own capability to deploy resources and equipment and experts on the field is something very, very important for us, yes, in the future.